And thank you everyone for joining us today. It's much appreciated. I know how busy everybody is. So we've got myself, Michelle Wood. I'm a project manager supporting the public health team at the moment with anything outbreak related. And we've got Rebecca Pickup, who's joined us, who's a public health consultant, registrar consultant. Always get that a little bit wrong. Sorry, Rebecca. And we've got Rebecca Howell-Jones, who is our Director of Public Health. And I did see Jane Coggle on the call as well, but I'm not sure if she's gone. I can't see everybody's names on my screen now. Sorry, there's so many of you. And she's one of our environmental health officers if she is around.
I'm here.
Ah, brilliant. Thanks, Jane. Sorry, you'd gone off my screen, so that's great. So yeah, there's a few of us on the call today to help with any questions that you may have, but we have got some slides to share with you, so I'll just pop those up. And Rebecca's going to run through those for us. Thank you. The first technical issue. They're on my screen. Always the way. For the delay there.
Okay, I think Rebecca Howell-Jones is just going to have a start off. Yeah.
Thanks, Rebecca. Sorry, too many Rebeccas or Becky. Please, yeah, feel free to call me Becky and the other one Rebecca. I was just going to say hello and thank you ever so much, everybody, for joining us. Yeah, we'll quickly run through the slides showing kind of outline of cases and where we are at the moment. Have a little bit of a chat about lessons learned, some of the situations that have occurred locally and sort of across the region, accumulating some of those lessons learned to share with you. Have a bit of a touch on lateral flow testing and vaccination, and hopefully we will have some time for questions either at the end or post them through the chat as we go. We'll also leave you with our contact details, I'm sure, so we can feel free to get in touch should there be any questions. I think it really is just the kind of I think the messages nationally have shifted, but also just to recognise that this is this isn't going away anytime soon, and actually it's about kind of how we position things and how we work through at least the next year and beyond that to contain the virus and obviously help us get back and businesses operate as best they can. So I'll hand over to Rebecca now for the overall picture and speak later. Thank you.
So this is a slide we use quite a lot, which shows the number of cases. It's got quite a lot of detail on it, so just look at the overall picture. You can see that we've had the different lockdown periods, you can see the ups and the downs, and you can see we're much higher now, but just remember that we do a lot more testing now than we've ever done before, but there is still a considerable amount of virus, even though lockdown is having a really good impact in Herefordshire. But it just shows how important it is to keep those measures in, because whenever there's been a release of lockdown, we've seen quite a substantial rise in cases, and we can't let that happen every time if we're going to go back to something that's more resembling normal. Let me move on to the next slide. Okay, lovely. So this is the last 7 days of published data. You can see the dates along the bottom. And you can see there's 227 new cases between the 29th of January and the 4th of February. So that's just over 118 per 100,000 cases. I think you can see it was in the news, or your Herefordshire, it seems to be like the latest news in Herefordshire at the moment, that we've now gone under 100. So hopefully we will be able to stay there and get it down a little bit more. The lower down it is, the better position we're in. So everybody needs to work together to get that case rate as low as we possibly can. Can we move on to the next slide, please? Yeah. This is a nice slide, and you can see that we're surrounded by other counties, and this is what happened back in January. So we found that we had quite a low case rate, and they put us in tier 1, but we were surrounded by places that had higher case rates. And no man is an island and no county is an island when you're thinking about Herefordshire. So people are coming and going. So we need to make sure that in Herefordshire we've got the best measures going, and we're all working together to make life better for everybody and to reduce the number of coronavirus cases in the county or coming into the county as well. Okay, so this is I refer to this as like a tartan rag, so it shows the different colours and the age profile of who's getting coronavirus, and that's confirmed cases. So you can face cases that are confirmed either with a lateral flow device now or a PCR test. the age goes up on the side here, and time goes along, and you can see how it sort of started being in younger populations, and it's very much gone across, but also concerningly in the older populations, which is what we really worry about, because it's older people that have the worst impact of COVID. So since we move on to the next one, this is the mobility data. So this kind of shows where people are going, what they're having. You can get this quite freely available on from Google, and you can see the impact of the different lockdowns. So you can see how people have done different things, and retail and recreation have kind of come off when there's been lockdowns, and you can see that actually people have mostly followed the guidelines, and I think that's a really important message actually, is most people are following the guidelines to the best of their ability. We hear about a lot of people that aren't on the news, but that is not the general picture. Most people are following the guidelines, and it's really important that as many people as possible follow the guidelines to the best of their ability. Okay, lovely. So this is moving on to learning from local COVID outbreaks. So I think I'll hand over to Jane now. See you there, Jane. Jane? If not, I can continue. Shall I continue? Okay. So Jane, take over from me if you become available. There's probably technical difficulties happening here, but this is a really nice slide that we've had through, which is about learning from local outbreaks. Are you there, Jane?
Yeah, sorry, I can't. I couldn't get myself off mute.
That's all right. I'll hand over
gone. You carry on for a sec till I get myself back. Do apologise.
Don't worry, I'll carry on for a sec. So what we find actually is that when there's been local outbreaks in all sorts of places, is that, you know, as there is, because people have coronavirus and they come into your workplaces, and you know, that's something that you're not going to be able to stop, because there is coronavirus in the community. What you need to focus on is not having transmission within the workplace, or if there is transmission in the workplace, stopping that as soon as possible and keeping that as low as possible. And there's several kind of learning bits that we've had from here, and they're all seem to be the same. So these are the key ones that we've got. Ventilation is incredibly important. So you should feel like the impact of the cold. So I know it's really cold outside and it's not very nice, but you should be able to feel that breeze coming through, otherwise you don't have enough ventilation. Most of the transmission is in the air, so it's from one infected person to another person, and it's in the air. So you really need to think about ventilation and what you can do in your circumstances as well. Obviously, we can share these slides afterwards so you can see some of the details. I know that it's a little bit small. Also, what we found is group gatherings. So we found that people have been so careful, and then say 6 of them have met in a room for an hour and a half. And you are going to, you know, there is going to become full of other people's air that they've breathed out, and that might contain coronavirus. So if you're sitting in a room unnecessarily having a meeting, that's not a good thing to be doing. And there's plenty of other opportunities for that. So every time you just need to think, do you really need to have this meeting? Is there a safer way to do this? Breaks. I always like this as breaks, because whenever we talk to people, and particularly if you've kind of got a public facing element to your job, so for you, I don't know, doctor surgeries, or for example retail as well, and then you've got a back bit, that you're doing so much and so careful when you're facing the public, and then it comes to a break and you're really close together and you're making each other cups of tea, because you know that's what you always did and that's normal human behavior. But that's just the right time to spread, you know, the virus, because you're quite close together. You haven't kind of thought about space. You might be passing each other mugs and stuff, so you've got the kind of touch element as well that you might be transferring through touch. Work bubbles, we found this as well quite a lot, and I understand that this is really difficult, that if you work with people together and then all of a sudden you've been working with them all day in a bubble, and you think afterwards, it's a bit strange then, isn't it, to put in kind of spacing and not to see people that you've worked with all day. But it's really important, because your workplace will have lots of measures in place that won't be in place outside. Also, you will relax a little bit more outside, so you'll get together a little bit closer and you're more likely to spread the virus then. And that goes into socialising outside of work as well. Oh, and cleaning projects. I can't tell you the amount of times that people have done so much cleaning, they've done it really well, and then they found out that their cleaning project doesn't actually kill the virus. So it's really important just to have a check. And the other thing that's really important as well is contact time. So when you put your product, if it's a spray or a wipe on the surface, you need to make sure that it's left without being wiped off for the amount of time that it states on the back of the product. It's usually about 60 seconds, but it's really good to check. If you've got outside cleaners doing your cleaning, do check this with them and make sure that they know and they're doing these procedures. And this is one of my personal favourites is car sharing. There's been so many times that we've found that there's been a small outbreak in a workplace. And when we've done all the investigation, we've got contact trace on, those 3 or 4 individuals actually were in a car together, and that's when it's transferred. So the business has looked through all of its procedures, and it's can't identify anything. Actually, it was a car sharing where people had a lift to work, or they had a lift somewhere after work as well. So it's really important to kind of to talk about that with your staff and to reduce car sharing wherever possible. I mean, obviously, if you can work from home, working from home is always the safest place to be. And I think with the great thing about coronavirus is it's all made us think a little bit differently. And I think people have identified opportunities that we didn't really know was there. So really do think about who is in work. Do they need to be there? How do they get to work? What's the safest way for them to get to work? And if they are car sharing, it's really important that they identify this early, because those other people in that car will be contacts. Admin areas, this is another one that we've found, is that you're all in the same place for a long period of time and you're used to making each other things like cups of tea. So we find that it spreads a lot around admin areas. And this is another key point about how much admin do we need in-house to run the business, and how much can be done from other places. So you need to keep a small number of admin staff in the business as possible, and consider bubbling as well. So if you can have teams, so say if you do need to have people in, you say Monday, Tuesday, Wednesday is done by the same team, and then a different team comes in Thursday, Friday if it has to change, and you don't swap between the two, because that reduces risk and reduces the number of people that are together. Beverage bays and kitchenettes, I think I've discussed about this earlier. There's so many places that people just sort of touch and together. And it's really important to keep up your hand hygiene and your cleaning and make sure that you stay apart, and just don't go into an area if there's people already been in there. It all sort of runs in together. Shared items, we quite like this one. We call this the biscuit tin or the fruit bowl, and where people keep dipping their hands into stuff. And this is often like the missing link. So we can be talking to someone for ages and we can't identify what it is. And it turns out that actually somebody brought in a bowl of sweets and everybody put their hands in it. So it's the small things actually that we don't really think about that tend to be a problem. And touch point cleaning. Now, yeah, this is one where you need to go around your business and think about what is it that you touch. So you think about handles, door handles, and you think about light switches, but is there a bunch of keys that actually several people touch because you can pass it through the bunch of keys? Or is there a key safe that you have on the wall that multiple people will touch? Because all of those things are things that we don't really think about, but ideal for passing the virus around. So just making sure that you identify those, maybe with an audit, and just sort of check and look that you're cleaning them afterwards. And then of course, environment, furniture, just make sure everything is really clean and that you're using, as we said before, the right cleaner that will kill the virus, and leaving it on for the amount of time it says. And here, I've said it before, but absolutely, without doubt, the best place for anyone to be at the moment is at home, so that you can't pass between each other. And you might have to think of creative ways to do this, but I'm really impressed with actually how Herefordshire as a county has managed to do this. And I think that actually it will be a great thing for the future. We have good infrastructure, and people are sort of creative ways to adapt their business so that it can be run from home, and to limit the amount of people that are in an office or a work environment together, a factory together. Okay, do you want me to do lateral flow testing, or have we got Ashok on?
Ashlock's unable to join, Rebecca. If you wanted to run through the sort of how the lateral flow tests work, and then I can run through the actual where they are and where we are with that community testing plan, if that's all right.
Okay.
Thanks.
I don't know if anybody's, I don't know if anybody's had a lateral flow test. They're quite often shortened to LFT or LFD, lateral flow device testing. But they are, I mean, it's a technology that's been used for a long time. It's been used in pregnancy testing, but this one has been developed for coronavirus, and it's really helpful because it tests when you are infectious, and it's really quick as well. So one of the problems we have with a standard test is that you have to go to somewhere, have it, or you have it at home, and then it gets sent off to a lab. And that is a time delay. And in outbreak situations, the quicker things can be done, the better, because we can get on top of things really quickly. So lateral flow tests are brilliant for that, because they will find out if you're infectious. So it won't find out if you're pre-infectious. And the thing about a test is that it's only right for that day. So don't think for the next week you're fine, because it could develop at any time. But on that day, at that time, then you don't have it. And it's, as I say, it's really good because of the speed that we get the result back in. They're quite easy to do, but they're not very comfortable. They're quite similar to the PCR test. It does need to go, and you do need to get a really good sample. So, you know, have a good go in there, and people will show you how to do that. There's videos, and there'll be training at the centres on how to do that. So lateral flow tests are for people who are asymptomatic. So that's people who are not showing the symptoms, which is a new continuous cough, a fever, and a loss or change in taste or smell. A lot of people are asymptomatic. We think a third of people. So this is really important that we can roll this out to people who can't work at home, because you might be wandering around, passing around the virus. So why would I want to introduce this testing to my workplace? Well, because it would identify anyone who's infectious at that point. And that means that other people who've been in close contact can be identified very quickly, and you can keep that as small as possible for them to isolate. So actually it makes your business more resilient. And this is going to be incredibly important in the next year as people start to go back to work. Because what you don't want is to have large scale outbreaks. You've just got back to work, you just started it off, and all of a sudden you're going to have to close the whole site because you've got an outbreak, and you know it took a couple of weeks to identify that, and it's spread around quite a lot. So if you have over 50 cases, then 50 employees, sorry, then you can apply to do LFT testing in the workplace. And there are other offers available. So there's the community testing offer that we show here. That has only recently been approved in Herefordshire, so that will get more and more, and that's really good for if you've kind of got people who don't come together. So if you don't have a factory or one place where people gather, you can go to a community test site instead of setting up your own testing. Or if you've got a small number of employees, so actually the effort involved wouldn't suit you, but going to a community test site would. And I say in the institutional testing offer, this is where businesses that have over 50 employees can set up their own testing. So that might be more suitable for you if you have lots of people at your site.
Brilliant, thanks Rebecca. So yeah, just on that, so the institutional testing offer can be accessed by emailing the email address that's on there, the P&P sector, but I will circulate that to everybody afterwards. On our community testing offer, that's been moving at pace. As Rebecca said, we've recently had our confirmation that we can go ahead with that offer, and we've been setting up test sites across Herefordshire. So we've now got a lateral flow test site at Hereford City Point 4 site, and that runs Monday to Friday and also a Saturday morning. We've also set up this week Ross on Wye at the Ryfield Centre. So that's now open on a Monday, 8 till 2, and Thursday, 12:30 till 6:30. And we've also got Ledbury Masters House, and that's going to be opening up from the 16th of Feb. And that's going to be available Tuesday, 7:30 till 12, and then Friday, 2 till 6:30. And we're also looking at additional sites, and also looking into exploring some possible mobile sites, so that we can obviously move around the county and maybe come to some industrial estates where businesses are and make it more accessible for you guys. what we're trying to do at the moment, we're obviously we are rolling this programme out, but we're also trying to keep a control on sort of make sure that we've got enough accessibility for everybody who requires it. So if you are interested in accessing that community testing offer, there is the Outbreak Control Hub email address. If you could just drop that email address and email with the amount of employees that you'd be looking at to access that, then we can just see how we can best help you and send you all of the booking details. There's a booking system set up, so your staff will be able to log in, access and pick a convenient slot. But I must stress, this is for key frontline staff or key essential workers who cannot work from home. It isn't just for the general population at this time, it's for those people who have no other choice but to go into the workplace. So yeah, please do drop that as an email, but I will share those with Olivia and we can get those out to you.
I did the classic there of not unmuting myself. I thought you might want to know a little bit about the vaccination, how vaccination's going in Herefordshire. It's what most people want to talk to me about at the moment, so I thought I'd do a little rundown. So at the moment we have the 9 priority groups, and they're set by government. It's not so set locally by public health, it's set nationally by government, and they are based on reducing death, so reducing mortality, the people that are most likely to have the worst impact from COVID. I've put a little box around the first 4 because all those people now have been offered an appointment, and we're going back to say, if you haven't taken up the appointment, you know, would you like one? Please come and get your appointment. So if you know anybody that's in those groups, so over 70, then do ask them if they've had an appointment. If they haven't, either contact the NHS on their behalf if they need a bit of help, or you know, ask them what would help them get the vaccine. It's very important that people do and get it at the earliest opportunity, and then go back within 3 months to get their second dose. It's envisaged by the end of May that all those 9 groups will have had their first dose of the vaccine. So what will be the next stage? So this is probably interesting to most people here. Well, we're not entirely sure yet. This hasn't been agreed nationally. They will look at the learning from the first phase of the vaccination to prioritise the next stage of vaccination, which would be everybody under the age of 50 who doesn't have a long-term condition that gives you flu or isn't extremely clinically vulnerable. They need to know a little bit more about what impact the vaccine has on transmission. So if you've had the vaccine already, if you're in one of those groups, then you're still able to pass on coronavirus. So it's really important that you still follow all the rules, and you know, if you get symptoms and you get tested just the same as anybody else. So it's really important to remember that you are not now immune to passing on the virus to other people. You need to keep going with all the things that you've been doing so far. It's really important. And at the moment, JCVI, who are the people that kind of give the recommendations on where the vaccine goes, believe that the next stage of the vaccine should look at reducing hospitalisation. So that tends to be in older age groups. So, but we will, when we find out more information, that will be released nationally from government. And what's happening in Hereford, vaccination in Herefordshire? Well, we've had really good uptake in Herefordshire and Worcestershire, which is absolutely fantastic. You can see there 93.7% of over 80s have already been vaccinated, and that was on the 31st of January, so I'd hope that's even higher now. And we've already at that point had got to 41.3% of over 70s, which they'd only recently kind of been added, released to the over 70s at that point, so I would expect that to be much higher now. As I said, anybody who hasn't been vaccinated in those groups, if you're in that group or if you know somebody who's in that group, then please encourage them to be vaccinated and see if they need any help to get to a vaccination centre. We have 5 local vaccination centres, one's in Ross and Wye, one in Ledbury, one in Leominster and 2 in Hereford. So there's lots of vaccination centres to go to. And there is a regional centre planned, so and that's for 3 counties in Malvern, but that hasn't come online yet and is expected to come online within the next month or something like that. How you would get an invitation would be either being called up usually from your local doctor, or you'd receive a letter to go to a national centre, and that would then take you through to a link and you'd book on to your nearest national centre. So there is ones in Gloucester, for example, that you could go to. If this comes to you, then please pick one and make the appointment and do go to it. And if you have any questions that you need answering, then speak to your GP, and there will be somebody at the vaccination centre to answer any queries as well.
Brilliant, thank you. I'll take the slides down then, because that's the end of the slides, so we can see everybody, because that's always better, isn't it, than just looking at slides. And I'll hand over to you, Becky, if that's okay.
Sure, thank you. Just quickly, if Jane can, don't know if she can unmute, if there's anything you wanted to add, Jane, before on.
Yeah, sorry about that. I managed to minimise my screen because trying to get a colleague in, and then I couldn't maximise it. So I do apologise, and thank you, Rebecca. You did a better job than me. I think the only thing I wanted to add to that is that it appears to me, we haven't done a huge amount of visits, but the few visits I've done, it appears to me that there's a sort of mismatch between theory and reality, where businesses are very, very good and they're working very, very hard to put everything in place. And they think that once they've done that, everybody's going to comply. And actually the reality is that human nature takes over and people don't comply. So I would say that it's really important for businesses to try to create a culture around this, where it's okay to tell each other, oh, step back, you know, have you cleaned that, have you sanitized that, that kind of thing, and try to encourage. Even COVID champions has worked in some businesses where somebody's kind of employed to be the bossy one and go around and remind everyone what to do. So I think that was the main thing that I found, because human nature is for people to be too close and to carry on doing what they've always been doing. And the other thing that I've encouraged people to do is to do sort of spot checking and auditing. So actually somebody, you know, just get up from their desk or whatever and actually physically go around and see if everything is working as it should be working, not just assume it is. And also to have a proper audit where once a week maybe somebody goes around and checks in more detail, you know, the cleaning chemicals, the wipes, whatever, that everything's in place and that the person who says they're going to do it is doing it, and so on. So yeah, just overkill, I think, would be my advice. Thank you.
Great, thank you, Jane. So I think we're very happy to take any questions, and also to hear kind of about the challenges that you're facing, and any, you know, any kind of particular concerns you might have. Obviously, we're trying to answer questions that we can today, but if there's anything we can't, we can take it away and consider and find out much further.
Yeah, thank you. Thank you to all of you for chipping in there. Some really interesting statistics and some really good takeaways. Has anyone got anything they want to share, comment or ask while we've got 4 experts actually today? You can either take yourselves off mute or put something in the chat. Emma, is that a hand?
Yes, please. Hi there. Can you hear me? Because I'm looking at one screen and speaking to another one. Okay, sorry. We are a group of companies that just come in under the 50 employees to be able to register for the LFA testing scheme at work. But we are very happy to invest in our own stock of LFAs because we do a lot of medical and health work anyway. We have a good relationship with a provider of LFAs who have already passed their phase 3 validation at PHE, etc., etc. But what I've had difficulty discovering is if we're using LFAs that we've sourced privately, how do we report a positive case if we are in the unfortunate situation where we get one?
Say that, Michelle, or do you want me to comment? I can't see if she's trying to.
We've had a couple of businesses that have been purchasing their own tests, and what they've been recommending for if they were to have a positive test would be to then go and have a PCR test, because then that does link you into the national track and trace system. And I know that there is guidance right now that says if you've had a lateral flow test in a community testing situation, you don't necessarily have to have that PCR confirmatory test. But obviously those results are already being loaded into that system, and that positive result is already being counted and you're already linked into the national system. So I think, I don't know if you agree, Rebecca, that the advice would be to have that PCR test and then you are linked into that national system as well.
Because Michelle, just to quickly jump in there, I did call, there's a a number online on the gov.uk website, to which I think puts you through to sort of a PHE helpline that's been set up. Their advice was that we should call that number to report the case, or to report it to directly to our local public health authority, which is why I was very keen to meet you guys this morning. Because yes, the advice definitely has changed to, don't go and access a confirmatory PCR test. And I know that there's been some issues because of the work that we do on this, whereby if someone's got, some kind of residual RNA from the virus in their body, they can, or vice versa, they can end up having a positive on the LFA and negative on the PCR. And then we're in a position as a business where we don't know whether we need to, which one we believe, if you see what I mean. The other problem being, of course, that people are often sampling, sampling error, I know, creeps in a lot. And so you can end up getting a positive LFA, then a negative PCR because perhaps someone's not sampled correctly at home or, at a testing center. So yeah, I'm just a bit sort of confused about what our company policy should be.
I think just to come in there as well, I think it's really difficult. I think the number one would be, if possible, to go through one of the national routes or through the community, through our community testing. So very happy to open conversations with us, appreciating that there is a limit to what we can support as well in terms of, every single site doing it, because there are aspects around the quality assurance, and particularly, making sure that those tests are run properly, that they're looked at the right time and things. And although there obviously will be challenges, just in general, by going through a national system, there's assurance on the training and there's assurance on the actual devices that you're using as well as it then being linked into the whole sort of test and trace and contact tracing side of it, which is really, really key. It isn't just about identifying that person, it's actually about identifying their contacts and stopping that onward transmission. And whilst I appreciate that as an employer and a company, you're probably able to do that in-house, it's actually about
that's what we're very anxious to do, is make sure that we can access that, that it then gets into track and trace effectively.
Yeah, absolutely. That's quite interesting that I told you to contact us, because I haven't been told that, so we will take that away as well. But yeah, I mean, you're right as well, that you can get positive on one and negative on the other. The likelihood is that PCR is more, PCR is more sensitive, so you're likely to get a positive if somebody's had an immediate had a lateral flow that's negative and then goes on to a positive PCR. But you're right, at the moment there's no requirement to have a confirmatory
test.
Okay,
and so in terms of accessing that confirmatory test, obviously we're talking about asymptomatics here, so when someone is trying to book that test, what should they put in order to bypass the system of you should only access it if you have symptoms?
There is an option to put, or my local authority has told me. So I think if we agree that's the only route to be able to get into testing.
Okay.
I think you can. Last time I looked at it, you might even be able to say, I've had a positive LFP.
Okay.
It was on one of the drop downs before. I don't know if they've taken that away with the change of advice. But yeah, if we touch base, well, we can always come back through the chamber as well, but we'll investigate that, whether we can take that for you. I mean, again, I go back to my first point, it would be better to do it through one of the portals so that you can register the kits themselves and make sure the quality assurance is there. Yeah, obviously we don't want to lose those positives when it's done outside of that.
Sure.
And also, without, I suppose the only thing to say, obviously it goes without saying, but also on a positive LFD, please, the advice has got to be to isolate, for the households to isolate as well.
Yeah, absolutely. I mean, we've written a policy document which outlines all of these things, and it was just the reporting of the positive case and whether we should advise a confirmatory PCR or not. And as you're probably aware, on the gov.uk website, there are actually a couple of places where the advice is contradictory, but mostly the pages seem to be saying now, until further notice, a confirmatory PCR is not required, but it doesn't specifically refer to, individuals, companies who aren't able to access through a government provided scheme.
The only thing as well, I mean, anybody who's testing themselves at home does still require a PCR. So even when it's, the in care homes, for example, where they're able to take it home now, if they're doing that testing at home rather than in an on-site, they do require a confirmatory PCR.
Okay, great. Well, that's really helpful. Thank you, Rebecca.
Thanks, guys. We've had another question in the chat. I'm happy to read it out. I don't know which of you can answer, so I'll read it out and you can just go for it. Could we use the community testing option if we have over 50 employees in the company?
My question would really be, how many employees have you got? And please do drop the Outbreak Control Hub an email with that information and we can look at it. At the moment, obviously, we're setting up the sites, but we've only got a certain amount of capacity. So we are trying to say to people, if you are a larger employer and you've got that capacity to be able to set up your own on-site testing, that would be the ideal route that we'd be looking for you to go through. But obviously, we don't want people not to be able to access testing either. So yeah, please do drop an email. Have about 60 employees and only 5 work from home. It's something that we can certainly look at, Kerry. Apologies, I haven't got a direct complete answer now because we're still trying to increase our capacity. So in the future, I think we will be able to do that. But at the moment, we're trying to sort of prioritise areas that aren't able to access testing through any other routes. But I can certainly continue the conversation with you, Kerry. I can get your email from Olivia, if that's okay.
Yeah.
Okay, so that's lovely. Thank you. I have registered with the other website. We say the institutional testing, but it's quite scary. The enormity of testing in the workplace, really. So that was the reason for my question, because we were sort of just over the limit. But
just on that, Kerry, is that something that this is just as a probing question, just I'm not saying we can definitely offer it, but if we were able to offer any additional support with your training, is that something that you would then look at, or is it something that you're definitely not interested in at all? Because we've got obviously staff that are trained to do this, so I'm wondering if we could give you any additional support to help you set up on site.
Yeah, no, I appreciate that. I think it's also for us. I know it sounds silly because we want to do everything we can, but we're also sort of push for space of actually where it is a good place that we would be able to. We have no spare office space, so it's the logistics more on that point of view. But yeah, I'm sure if we did decide to embark on any help from you guys with training, we'd very much appreciate. So we'll look into it. I just wondered whether it was an option, whether we could use your community testing sort of in the meantime. We are keen to do it.
I'll continue that conversation with you offline, Kerry, and we'll have a look at the numbers and just make sure that we've got the capacity, because at the moment what we don't want to do is overwhelm the test sites while they're still in their infancy, and we will increase the capacity. But yeah, I'll continue that conversation with you and we'll see how we can help best.
No problem. Thank you.
Thank you both. Anybody else got any questions? Yeah, Beth?
Hello, so it's a slight aside actually to what you've been talking about, but I just wondered if you've got any idea what the capacity is at the hospital at the moment. I work for Yeleni Therapy and Support, and we support anyone living with cancer, and obviously a huge awareness about, not a lack of support, but late diagnoses and people worried about going in to see GPs or whatever to if they've got a concern. So I just wondered if you knew where things sat at the hospital, really, please, in terms of capacity and about returning to some sort of normality, re-supporting people with cancer, please.
Sure, I can let you know what I know. It's not, I'm obviously not the best person to answer that question. In terms of the, if you look at the data around the COVID cases in hospital, that's coming down as well. So we've seen the community cases coming down, and that sort of community transmission, and that has then sort of now started to come through in terms of those hospital cases coming down, which is really, really great news. So I think we are at a situation where we're starting to look at potentially, how do we get back? Because you're right, there is there's going to be a big gap, isn't there? And a lot of catching up and a lot of work to be done to the unintended consequences, both in healthcare and people's direct health, as well as other consequences around inequalities and loss of education and other aspects as well, to return and make ground. So I think in terms of healthcare colleagues, I think it's starting to go in the right direction. My understanding is it's not quite at that point yet where they can, you know, go back to the total offer. But I think, yeah, looking at the numbers, it's coming down, and hopefully that will be able to change relatively quickly.
Okay, thank you very much. Thank you.
Thanks both. Any other questions? No? Okay, we can probably call it a day there then, guys.